As Lassa fever continues to pose a serious threat to public health, the Commissioner for Health, Dr. Siri Adams Oshomole, has declared an emergency outbreak of Lassa fever to curb the spread of the disease across the state. The Nigeria Center for Disease Control (NCDC) has swung into action as they collaborate with the Ministry of Health to visibly participate in the fight against the disease. This was shortly after the increase of affected individuals and high death rates in the state. The Honorable Commissioner for Health, Dr. Siri Adams Oshomole, in his speech said that the declaration was as a result of careful review and assessment of epidemiological risk in the state.
Following a careful epidemiological review and the risk assessment by the Edo State Ministry of Health, I hereby formally declare a Lassa fever outbreak in Edo State. As at today, Edo State has recorded 28 laboratory-confirmed cases of Lassa fever with reported 6 deaths. The recent increase in cases, particularly in Issaquah West and Esa West local government areas, signals sustained community transmission that requires immediate, coordinated, and escalated response. Edo State government have been proactive, knowing that Lassa fever outbreak has become periodic by donating Lassa pack to Ira Teaching Hospital. Now, what is Lassa fever? Lassa fever is an acute viral hemorrhagic illness caused by Lassa virus. It is primarily transmitted through contact with food or household items contaminated with urine or feces of infected rodents that we also call mastomys rats. There is also human-to-human transmission, which can also occur, especially in healthcare settings where infection prevention measures are not strictly observed. Early symptoms may resemble that of malaria or typhoid. You could have weakness, headache, but can also rapidly progress to severe illness if not treated early.
He further stated that, in line with the national and international public health protocol, he commenced immediate activation of all pillars of Edo State Public Health Emergency Operations Center (EOC) with immediate effect to enforce adequate response system, thereby appointing various medical personnel to provide daily situation report to his office. The Director for Public Health, Dr. Siri Ojefo, from the Ministry of Health, Dr. Ekaete Tobi, a consultant for public health physicians as incident manager for the disease, Dr. Edewi Osaiwe, as the case manager to oversee all clinical coordination. This, which he said, is to take immediate effect.
In line with national and international public health protocol, I announced the following measures: that activation of all pillars of the Edo State Public Health Emergency Operations Center with immediate effect. The response will be fully coordinated under the leadership of the Director of Public Health, Dr. Stephen Ojefo from the Ministry of Health, who shall provide daily situation report directly to the Honorable Commissioner for Health. I also appoint Dr. Ekaete Tobi, a consultant public health physician, as the incident manager for the Lassa fever outbreak. Dr. Edueme Ewaye as the case manager, management lead to oversee clinical coordination and treatment outcomes, both from Ira Teaching Hospital. Now, this appointment takes immediate effect. Our response strategy will focus on enhancing surveillance, contact tracing, strengthening case management, capacity in treatment centers, rapid laboratory diagnosis, community sensitization, and risk communication, infection prevention and control enforcement in all health facilities, environmental sanitation, and rodent control measures. We are also working in close collaboration with the Nigerian Center for Disease Control, NCDC, WHO, and all relevant partners to ensure technical and logistic support. I urge all Edo residents to maintain proper food storage and environmental hygiene, avoid contact with rodents, and eliminate rodent breeding sites. Report early to the nearest health center if experiencing persistent fever or responsive to malaria treatments. Healthcare workers must strictly adhere to infection prevention control protocol. Early presentation saves lives.
Angela Ileguma reporting for PFM Global News.